My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you're interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Hello, my name is Marichelle Pita. I am a fourth-year medical student at NYITCOM and producer of this podcast, and you are listening to DO or Do Not. In this episode, we had the pleasure of interviewing Dr. Matthew Shatzer. Dr. Shatzer will tell us about the specialty Physical Medicine and Rehabilitation, also known as PM&R, and why it is the perfect match for an osteopathic physician. As Dr. Shatzer served as program director for Northwell Health for over 10 years, he will discuss what programs look for in prospective residents and the role of personal statement in the application. He will describe his own journey to PM&R, including his time at the prestigious Johns Hopkins in Baltimore and the Rusk Institute of Rehab. As I'm currently applying for PM&R through ERAS, I love this episode, and I'm confident you will too.
All right, Matt. Thank you so much for being with us tonight.
My pleasure. Thanks for having me.
So, Matt, I want to start with a general question. The question is, can you just describe for us in a nutshell, because I think a lot of our listeners don't know, what is PM&R, what is a physiatrist, and explain to us the whole specialty and what a rehab doctor does.
Sure. That's a great question because it's one of those specialties that there are a lot of people that are rehab doctors that their own spouses don't even know what they do. It's not as direct as, being a gastroenterologist or a neurologist. So PM&R is short for Physical Medicine and Rehabilitation, and we're also called physiatrists. So basically, it's the being a functional physician, doctor of function. There are so many disease states that impair people's function. Like, for instance, if you have a stroke and you have hemiparesis or a spinal cord injury or chronic pain that impede your function. So in our specialty, we manage conditions that impede people's functional impairments. And there's so many subspecialties within PM&R that focus in on more specific disease states. But so basically, PM&R, physical medicine, rehab are doctors of function. And it started really after World War I, when there were a lot of soldiers coming back with amputations and devastating injuries, and the management of those conditions fell into PM&R.
So, Matt, we're definitely going to take a little bit of a different turn than we do with our normal interviews, because I have so many other questions to ask you about PM&R, just for my own edification. So what is the role, or what is the piece with, let's say, a physical therapist? So I always think of, like, is the PM&R like the evil doctor, and then they're, not to insult the a bunch of minions, I'm not insulting the right? Like a bunch of minions under the doctor, or how does that work?
Well, there's definitely a coordination of care, and the vast majority of physicians will write a physical therapy script and it'll say PT, evaluate, and treat. Same thing with occupational therapy, evaluate, and treat. In our specialty, we work side by side. We write more specific referrals for physical therapy, or at least we're supposed to, with a little bit more detailed physical therapy programs, whether it be with someone's back pain, a specific therapy program, or someone with a stroke. And what we have at our disposal that a physical therapist doesn't is, we can do interventions, and I can get into it later if you like Botox for spasticity, or, managing pain and other things like doing epidural injections and the such, which a physical therapist wouldn't do. But there's a lot of people that the therapist and the physiatrist were called, or, PM&R doc or rehab doc, work side by side doing these things together.
That's great. Yeah. So, Matt, my follow-up question is, when we think of physical medicine, we've done 100 episodes on this podcast talking to DOs, And we talk a lot about what makes DOs different. And of course, we're complete physicians, but we always talk about manual medicine. So my next question for you is, we always talk about family practice being such a great cornerstone, which of course it is, and really fits with the osteopathic philosophy. Do you think that PM&R is the perfect specialty for a DO to go into?
Oh, it's absolutely perfect. It's in medical school as a DO, you learn about diagnosis and hands-on and the ability to do things like OMT to improve patients' outcomes. And there's a lot of, DOs that provide these treatment interventions. But another part of it is we're really good at physical examination, particularly musculoskeletal examination and neurologic examination, which is a really important component of PM&R. So yes, I think being a DO is a perfect background for being a PM&R doc, and a lot of docs are DOs within, in our department. Our vice chair I was our previous program director, but also our current program director are DOs. And actually, we have a couple fellowships, and both of the program directors in that are DOs. So there's definitely acceptance of DOs and plenty of DOs in our specialty.
Matt, that's awesome. And again, I'm going to bounce in and out of sort of our regular questions. So
Sure.
One of the regular questions that we ask on our interviews, which I'm going to ask you now, is, can you tell us a little bit about what a normal day looks like for you? Maybe even today, doesn't have to be today, but,
Sure.
From when you what time do you wake up in the morning? And then just maybe a couple of patients that you might see during the day. And then what time you get home at night?
Sure. And again, this is my particular specialty. I did my residency at PM&R, and then I did a fellowship in spinal cord injury medicine. Most of my patients I deal with are neurologically complex patients, whether they be spinal cord injury, stroke, traumatic brain injury. So in a typical day, I get into the office, and I spend half the time in the office, half the time at the hospital. And in the office, if I get in at 8:30 or so, and I see some patients, I've fallen into more of a spasticity management and neuro rehab. So I do a lot of Botox injections for spasticity, not for most of the patients get very excited when I suggest, and their family members get excited. Yep, when I talk about Botox, because they think it's for their wrinkles, but we do it for spasticity management. I do, as far as other procedures, intrathecal baclofen pumps for refills for spasticity management, and also managing certain things such as pain, neuropathic pain, some chronic pain, and even spasticity with medications, and referrals for physical therapy. So I would be in the office, let's say, from 8:30 until noon or so, and then I go to the hospital, and it's different there, where I'm actually seeing hospitalized patients at North Shore for any rehab needs they may have. And a lot of it is determining people's disposition from the hospital, what type of rehab. And there's different types of rehabs, acute, subacute, and some people go to outpatient rehab, and also managing other issues in the hospital. But, again, that's my experience. I mean, there's a lot of people that do, interventional pain procedures all day, doing epidural injections. There's people that do pediatric rehab. There are people that work on an inpatient unit, in a rehab unit, managing patients there. So, and, the amazing thing with rehab is when you start, it's almost like starting over. You can go to peds, you can do chronic pain, you can do geriatric, you can do spinal cord injury, brain injury. There's so many avenues to go, but, that's my typical day.
That sounds great. And I always say for internal medicine, and it sounds like PM&R is similar, that if you don't know what you want to do, or you're not sure what you want to do, but you want to do a medical type career, do medicine, and then you can see if there's a specialty that you like. It sounds like PM&R is very similar in that way.
Absolutely. And I went into my PM&R residency thinking I was going to do more musculoskeletal. I was always into sports and had injuries myself and that sort of thing. But I came to love neuro rehab and spinal cord injury medicine. So then I went that route. And then, I kind of took a step backwards and didn't just do, wasn't as focused on just spinal cord injury, did all sorts of neuro rehab.
Matt, I'm going to, again, not go directly into our normal question set and ask you a little bit about your time as a program director. So You were program director at North Shore Manhasset for PM&R. Is that correct?
Yes. Yes. Well, it had multiple different names throughout. I was there for 12 years. I'm still there, but for 12 years, I was the program director from 2008 to 2020. And it was a good experience. I always enjoyed teaching residents. And when I joined, the program was not as developed. So over those 12 years, I got to develop the residency program to what I like to think is a strong program at this point.
So, Matt, we're going to ask you, for some of our listeners that are interested in PM&R and listening to the episode, what would you look at? So you get these applications through ERAS, right? You get a bunch of applications, and obviously we always talk about research, grades, scores, USMLE, COMLEX. Give us a little thought on how you approached applications and what you thought was important.
Yes, yeah, it's a good question. Well, now I know the USMLE is a pass-fail, so that's one less thing to, I guess, stress about. You just want to pass the boards. But as far it's a little bit more difficult because I would never blame someone for coming upon PM&R later, because very few people go into med school knowing what the heck PM&R is, let alone knowing they want to pursue it. So I always liked to see how someone found the specialty and what they did to learn more about it. It's nice to be in a million different clubs, but I always think if you're on a couple and you're really all in those organizations or clubs, I think that's important. Having some research is nice. And again, if you discovered PM&R as a third-year med student, it may be hard to have done specific PM&R research, but having some sort of background is good. To me, the interview was very important in that to speak to the specialty, to speak to what got you interested in it, and to just have a little knowledge about the specialty. And, there's so many things that are difficult to pick up, right? Like, I always thought the best resident was someone that was, obviously the faculty's there to teach you, but someone that's motivated and can, you see that patient with, let's say, Guillain-Barré syndrome on the floor at North Shore, and you would say, that's an interesting patient. Why don't you, look into that? And the next day, they can tell you the information and examine the patient with you and review it. I think it's very important to someone to be a motivated self-starter. I always found those were the best residents. But, being involved in some organizations, but again, delving into the organizations rather than having a list of 30 that obviously you weren't as involved in, to me was always important. And again, like I said, speaking to your interest and love of the specialty and having some understanding. It's funny, I remember more than once I would get a personal statement, and our specialty, physical medicine and rehabilitation, so short for PM and then the end sign R. It's more than once I would get a personal statement that said PM and the letter NR, and I'm like, how do I bring this person in for an interview, because they don't even know the specialty's name? So that's always a red flag to me. Obviously, gaps in med school, they happen, but being able to speak to them is very important also, because that could be considered a red flag when someone's interviewing as well. And it would help if you pass all your classes and get through the boards the first time around.
Now, Matt, always a question that comes up when I mentor students is, how important is the personal statement, and do you actually read the whole thing?
That's a great question. So when I was the program director, I can't say I read I would read through every personal statement, and it would be a big part for me to interview or not. I think our program now, because there's just been so much interest with our new program director, Dr. Landry, we have a couple people on the admissions committee, if you will, that read through the personal statement, and those statements are signed through. The personal statement is really important, especially now you're dealing with a lot of schools that are pass-fail, and maybe some honors, and also the boards are less of something to differentiate people. And it's really your opportunity to say who you are, tell us about you. And NICOM in particular is a school where I know they rate students top third, middle third, or whatever, however they do it, I forget, but something like that. So if I have 20 applications of people in the top third, how am I going to differentiate them? So I think it's important to have a strong personal statement. And also I think it's, like I said, Just a personal statement talks about maybe your personal experience in the field, maybe a person, like again, a personal experience. And if you've had an opportunity to rotate in the field, maybe talking about an interesting patient and that sort of thing, I think is important. Is it the only thing? Of course not. But you don't want to, things like spelling errors on a personal statement are always concerning, because I'm like, if you can't get the personal statement right, that's kind of that's a problem. So I think it's relatively important.
My next question is COMLEX versus USMLE. Do you, and for you, and you're telling me your program has a lot of DO program directors, so maybe a little easier, but do you think for your program, do you think it makes a difference? And for other programs, do you think it makes a difference?
It's hard to speak to other programs. I could tell you, for us, not really. I mean, I would, especially when I was a PD, I would have been a total hypocrite. I never took the USMLE. I took the COMLEX, and I never felt the need to have both. I think does it help a little bit? I suppose, but especially now that it's pass fail, sometimes I would find it would hurt if someone did terribly on the USMLE or barely passed it. They're just stuck with the COMLEX. So I don't think it's a huge deal, but I can't speak to other programs. So that would be a program to program question. And, an applicant can always call and ask as well, or reach out to the program director somehow.
All right. Great advice. Reaching out to ask is always a good place to start, right?
Yes, it always is. Because, you never know. As program directors change, they may tell you different things.
So my last question, Matt, on the application process, letters of recommendation. So let's say your nephew came to you and said, like, listen, I want to do PM&R. Who should I ask for letters? So do you think it's most important to get a physiatrist or a strong person outside of the specialty? I mean, do you have any advice on who should write the letters and what type of letters you think would be best?
I think it would be very helpful. And I think you'd have to explain why you didn't if you didn't have a PM&R that wrote at least one of your letters. And again, some schools are different. Some people are different. Some people discover it too late. So that's not a disqualifier. But if you've been interested since your second year of med school and didn't really take a rotation, or, I always would be concerned if I saw someone that had 3 or 4 PM&R rotations and they didn't have a single letter from a physiatrist. That to me was would have been a little concerning. So I think having a PM&R doc with a letter is definitely, it could be beneficial. But again, if you have 3 great letters from like an orthopedist, a rheumatologist, and a neurologist, and you have a great essay that speaks to your interest in PM&R, and maybe throw in there why you didn't have an opportunity to work with a PM&R doc, that's fine too. Letters have gotten tricky over the years, and over the years, you would see similar people or the same people writing letters, and sometimes, and it's through no fault of the student, you see one letter next to the other, and they were like the same letter with different names. So you do take the letters into consideration. I find that it was very rare that a letter could hurt someone, because sometimes it's more of a reflection on the letter writer. It could help you more than if they can really describe you personally and go into who you are as a person. That's a long answer, but I guess the short is yes, I think it's beneficial to have a letter from a PM&R.
Matt, that's great. It was long and excellent. So thank you for that. We're going to shift gears now and go back to sort of you. We're going to talk about your journey a bit. So can you tell us where you grew up, when you became interested in medicine, and when you decided you wanted to be a doctor, and if you ever thought about becoming a dentist?
Well, that's well, we know what the last one is. So first of all, that's great questions and interesting stories. So I grew up in Stony Brook. My father is now retired, was a dentist. I never liked the idea of being in the small space of a mouth, and to me, it never seemed like something that was rewarding. So I actually went to college out west in Arizona. We used to visit there when I was a kid, and I just loved the weather. My sister went to Albany. Nothing against people that went to Albany, but I remember visiting her like in October and saying, man, this is cold and gray. And if I have the opportunity to go to Tucson, Arizona for 4 years, I'm going to take it. So I went there not knowing I wanted to be a doctor. I think I may do business or something. So it turns out my roommate's father was an anesthesiologist. My roommate's brother had knee surgery, and he videoed the knee surgery, and we were at his house. I was a freshman, and I'm watching this video. I'm like, this is amazing. Medicine's so cool. So I'll never forget. I don't know why. You'd have to interview her. But my mom may be the only Jewish mother in the history of the world who, when I called and said, I think I want to be a doctor, she says, why do you want to be a doctor? I don't think you should be a doctor. It's so much work and this and that and the other thing. She was trying to talk me out of it. But despite that, I pursued medicine. And then, I wound up getting into NICOM, and I felt it was time to come back home. And, I liked the school, and I think it was, at the end of the day, it was a very good choice.
When you were at NICOM, can you tell us about your experience there and maybe some of the friends that you met? Obviously, we had Dave Galinkin. I think he's episode 5. You may be like 105, but
wow.
I love both of you just as much. So tell us about your experience at NICOM and who you met there and what things were like when you were there.
Sure. I loved med school, and I know a lot of people can't say that. It's stressful, but I felt like I learned so much. And so my roommate, who I never had met before, was Dave Galinkin, who an infectious disease doctor out east. And so we met at the interview, and it turned out like a close friend of mine from high school was his sister's housemate at Penn, and we got to talking, and then one thing led to another. We both got in, and we said, let's room together. And, he's been a lifelong friend, and it worked out great. So, I met some very nice friends there, nice people, some people that are working there. Dr. Moeller, Dr. Leader, who a lot of people know, were my classmates or the year behind me. Yeah, but I just, it was such a great experience because I felt like I learned so much, and I really enjoy learning, and it was just a lot of interesting topics, and it's kind of where I got introduced to PM&R. Listen, med school's stressful, no doubt, that there's a lot on the line, and you're always worried about the next level. And that's kind of the thing I also tell med students, residents. I find this, maybe it was back when I was there too, everyone's looking at the next thing. I think it's how we're programmed as doctors, right? We're in college, we want to get into med school. What do we do to get into med school? We're in med school, we want to get that residency. What do we do? When we're in residency, we want to get that fellowship or that job. And it's stressful, and maybe it's easier said than done. And it's easy now that I'm where I am in life. But I think if you enjoy where you're at and you put all your effort into it and take every opportunity to learn things and join organizations that may be interesting to you and delve into them, it'll be a fun experience too, and not like completely stressful the whole time. So med school was great. I met a lot of nice people. I learned a ton of stuff, and I felt really prepared at an NICOM, like we were talking before, as an osteopathic graduate going into a PM&R residency. Even though I was the only the only DO at the time that I started the residency, but in my residency. But then some followed me.
Matt, can you tell us specifically how you decided on PM&R? How did you pick that as a specialty? How did that come up? And then can you tell us about how you chose your residency program, where you went? And then I think you mentioned decisions on fellowship.
Sure. I had no idea what PM&R was. And then my first year of med school, towards the end, I met a physiology professor who was actually doing research on spinalized rats, and doing just research about spinal cord injury. He's spinalizing rats, looking at certain markers, and seeing how they did. And he was telling us about this field that I knew nothing about, and I started looking into it. Turns out this guy then gets a job at Kessler Institute, which I ultimately ended up as fellowship, a very well-known rehab facility in New Jersey. He's a director of research, and I went and visited him there, and then I was sold on the specialty. So then, I wound up applying. I don't like to use, I can say where I went. I went to, at the time, Johns Hopkins and Sinai Baltimore were one program. Now they're two. So I was at the Johns Hopkins Sinai Baltimore program at PM&R. And there's another very large PM&R program locally that I thought everyone goes there and heard so many good things about. And I think, very good people have come out of there, and it's a good program. I didn't feel a fit. I just, I think when you go on your interviews, and it's a little more challenging now. And the other recommendation I have, I know it's easier from a financial standpoint. There's really something to be said for going to the program and seeing what it's like. I know a lot of things are virtual now, because from the pandemic, and that's a good and a bad. It's good because you don't have to fly places or drive places and get hotel rooms and that sort of thing. It's bad because you don't get the feel of it. So I had never been to Baltimore for a day in my life, but I looked into this program and I went down there for the interview and I just felt so comfortable. And I said, I can see myself in this program. And it's not, it's one of those things that it's hard to have something tangible, but like you get a feel, it's like where you pick college, hopefully you pick a spouse, you just know it's right. And it's a feel. So I went down there. It was a great feel. I knew it was a great institution. And I wound up going there. And I was very happy to do it.
Yeah, so Hopkins, just for those that are listening, is like one of the best medical institutions, arguably maybe the best medical institution, depending on who you ask in the United States. When you went down there and were interviewing, when you ultimately trained there and you mentioned that you were the only DO there, did you feel a little uncomfortable? Did that bother you? Did that ever come up? Did people know what a DO was?
It was a little overwhelming, but it was, I guess I just felt confident that, especially our specialty, even though I was the only DO initially in that program, they had one that graduated a couple of years before me. So it's not like they didn't know what we did. And as much as, it's a great name and it's a great institution, people, even your colleagues, at the end of the day, they don't remember, is this guy the MD or the DO that you're working with? Obviously, they probably know, it's on your tag. But as long as you show up to work every day and listen and you're there on time and do what's asked of you, people probably don't really care if you're a DO or an MD. So, it was a little intimidating, just the big name and all that stuff. But once you show up and you work hard and you get into the flow of things, I didn't find anyone giving me a hard time about my medical school training, which was good. And I think that was, that was like over 20 years ago. I think now it's even more accepted, especially in our specialty. It's gotten just more and more DOs there.
And then, Matt, as far as thinking about fellowship, how was that decision?
So it's interesting. In PM&R, it's a little bit more of a challenge if you want to go into certain specialties because you have to decide early. Fortunately for me, spinal cord injury isn't one of the ones you have to decide early. But I remember fairly early in my training, though, you do your PG1 year as a transitional year. So really my PGY2 year was my first year of PM&R. I remember being on the spinal cord unit and just assigned to spinal cord injury to me was so fascinating. These are such unique patients, obviously unfortunate patients, and the thing I love most about PM&R is little gains go so far with these people. I'll give you an example of my everyday life. If someone comes in with a clenched fist, when you do Botox and they can use their hands a little and they can hold a fork and stuff like that. And I absolutely love that. And so I just thought it was a fascinating specialty. So that's when I pursued it. A lot of PM&R residents go into pain management, chronic pain, epidurals, doing interventional pain procedures. And that you kind of have to decide a little earlier. The interview process is a little earlier. And there's a lot of other fellowships. There's PEDS, brain injury. They have cancer rehab fellowships. Our department at Northwell has a traumatic brain injury fellowship and a cancer fellowship, which are very good specialties as well. And so I just, I loved spinal cord injury. I found it very interesting. So that's why I pursued that fellowship.
And then, Matt, after you finished your fellowship, tell us a little bit about what it was like looking for a job and what type of opportunities there were and how you ended up at Northwell.
Yeah. My grand plan wasn't ever to come back to Long Island. I'm glad I did. During fellowship, I met a Jersey girl and I kept a job. But, I did my fellowship. Again, it was Kessler Institute of Rehab, which is a affiliate of Rutgers. I stayed in the area just because there was a good job opportunity that came up. I stayed within Kessler for a time. And again, I always knew I wanted to be involved with resident training and student training. And it's something I always enjoyed. And then, I was there and I was fine at Kessler. I just didn't see a ton of upper mobility opportunity. And it turns out I saw like an advertisement for a residency program director at North Shore LHA. And I'm like, let me look into this. I interviewed there, and more difficult than the interview was convincing my wife that living on Long Island wouldn't be bad. And actually now she's super happy here and she would never move back. But it just kind of, I happened to fall upon this opportunity to be a program director at a relatively youngish age and get involved with that and be part of a growing program. The other thing our program had at the time, I shouldn't talk about rival med schools maybe, but Hofstra was just developing their medical school, and we had the opportunity to become a department.
2 more questions. Can you tell us one thing that's made you successful in your career/journey? And our little translation is, what would you say your superpower is?
Oh, boy.
What do you think's made you successful? I mean, you're a program director, you trained at Hopkins. What's the key to your success? What's really, driven you in your career?
I just think, I think having a curiosity and really enjoying what you do and taking every opportunity to learn, I think can be really anyone's superpower. I think, when you talk about trying to first just impress others, I always tell my kids this. You show up on time and you listen, and you'd be surprised how many people that eliminates right off the bat, right? And then you really find something you love and a passion, and you just dive into it. And I can't answer the last part because I don't have a superpower. But I just think really, and this is what I would say to anyone going into any specialty, that just really, you got to put the time in, but you find something you enjoy, and it won't seem like work, and you should be happy doing it. And it's really hard there's no magic potion here. Just be affable, be willing to take feedback from people, seek out feedback. I think that's so important. I think a lot of people that get into med school and get into residencies, they're high achievers as is, and they may not always be used to getting negative feedback, but sometimes negative feedback is the best thing. I think you always have to be reflective on things, and obviously you want to be reflective on the positive, but you also want to say, what am I doing wrong sometimes, and how can I correct it? No one's perfect, so I'll sleep on the superpower thing, and then you give it to give me again. Okay.
It's a great answer, Matt. Our last grand finale question is, can you give us one piece of advice that you were given by someone else that has really influenced you and you would like to pass on to our listeners?
Yes. Actually, probably the best piece of advice is what I just passed on, is that be willing to reflect on how you're doing, where you are in life, and be willing to accept negative feedback. And as long as it's, you always want it to be appropriately delivered, but just be willing to accept that feedback and say, well, how can I have done this better? How can I, if you don't get a grade, if you think you could have done better in this particular topic, well, how did I go about this wrong? Because I think it's so important in life to just try to correct what we're doing wrong. And then, if we do a little better each day, we're going to be great at the end of the day. And I really think that's very important.
Matt, I think that's super great advice. I had a chief who used to say the only good feedback or the only helpful feedback is bad feedback, which exactly as you're saying, I don't think that's true, but it's definitely sometimes more important to get that negative feedback so that you could progress and do better the next time, right?
Just one thing, as a program director, I remember I would get a faculty member say, oh, this resident did this and that and complain, and, like a PGY2 resident. And my first question was always, so how did they react when you told them this? Oh, I didn't tell them. So how are they supposed to get better? And, and then you get the evaluations. Not that I was looking to come down hard on the residents, but if you give me a perfect evaluation on everyone, it's not going to help them grow either, So it's always, if you get that that good instead of very good or excellent on says, okay, and don't be afraid to go to the faculty member or the teacher and say, hey, I understand I got this. What could I have done to get a better evaluation here? And I found one of my biggest challenges was not finding enough faculty that are willing to give some, negative feedback from time to time, which again, it's how we get better, right?
Matt, again, thank you so much. I've had a great
Thanks.
time. I really appreciate your time. You're awesome.
So are you, Ian. Thanks so much. It's great talking to you.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.